Hello, and welcome to our Healthy Care YouTube channel. Today, we're diving into a crucial topic for all new parents: caring for your newborn's delicate skin. Your baby's skin is not only soft and beautiful but also sensitive and requires special attention. In this video, we'll walk you through the best practices for keeping your baby's skin healthy and protected from common issues like rashes, dryness, and irritation. Let's get started. 1. Understanding your newborn's skin. Your newborn is finally home, and you're beginning to settle into a routine. One of your top priorities is keeping your baby warm and nourished, but baby skin care is just as important. Newborn skin is incredibly delicate, and your baby's immune system is still developing, making it crucial to protect their skin from potential irritants. Your baby's skin is sensitive to chemicals, fragrances, and dyes found in clothing, detergents, and baby products. These can lead to skin irritation, dryness, chafing, and even rashes. However, there are several steps you can take to safeguard your baby's skin from these issues. 2. Natural baby skin care tips. When it comes to caring for your newborn's skin, less is more. Newborns are born with a protective covering called vernix, which naturally peels off during the first week. There's no need to rush this process by rubbing or treating the skin with lotions or creams. Allow the vernix to peel off naturally, as it provides a natural barrier against irritants. Here are some key tips for natural baby skin care. Limit bathing. Resist the urge to bathe your baby frequently. Bathing more than 3 times per week during the first year can strip away the natural oils that protect your baby's skin, leading to dryness and vulnerability to rashes, including eczema. For the first month, a sponge bath 2 or 3 times a week is sufficient. Focus on cleaning your baby's mouth and diaper area in between. Gentle products. Avoid using scented baby products in the early months, as these can irritate your baby's sensitive skin. Opt for fragrance-free and dye-free options. Wash baby's clothes properly. Always wash your baby's clothing before it is worn. Use baby laundry detergents that are free from fragrances and dyes. It's best to wash your baby's clothes, bedding, and blankets separately from the rest of the family's laundry, or use the same gentle detergent for everyone. 3. Preventing and managing newborn dry skin and eczema. Many newborn skin problems, such as eczema or dry skin, don't appear until after the first month or 2. Eczema often manifests as a red, itchy rash, commonly found on the face, scalp, elbows, and behind the knees. To prevent and manage dry skin and eczema, consider these tips. Minimize soap usage. Limit the use of soap during bath time, and keep baths short to avoid drying out your baby's skin. Use only necessary skin products. If your baby's skin is dry, apply ointment or lotion specifically to the dry areas. Avoid using baby-scented skin products that can aggravate sensitive skin. Choose soft clothing. Ensure that your baby wears only soft clothing, preferably made from cotton, to reduce irritation. Consult your pediatrician. If your baby develops eczema or persistent dry skin, consult your pediatrician before using over-the-counter lotions or creams. Prescription treatments may be necessary for more severe cases. 4. Dealing with diaper rash. Diaper rash is a common issue that many parents face, often caused by the irritating wetness of a soiled diaper. Diaper rash can also develop if your baby's skin isn't properly dried after a bath, or due to a bacterial or yeast infection. Babies who are on antibiotics are particularly susceptible to yeast infections and diaper rashes. Here's how you can treat and prevent diaper rash. Frequent diaper checks. Check your baby's diaper frequently, and change it immediately when wet or soiled. Gentle cleansing. Clean the diaper area with mild, fragrance-free cleanser or plain water. If the rash is severe, use a squirt bottle to clean without rubbing the skin. Avoid baby wipes. Some baby wipes contain alcohol or perfumes that can further irritate and dry out your baby's skin. Instead, use a soft cloth with water. Pat dry. After cleaning, gently pat your baby's diaper area dry. Don't rub, as this can aggravate the skin. Allow the area to air dry fully before putting on a fresh diaper. Protective ointments. Apply a thick layer of protective ointment like petroleum jelly or a barrier cream such as Desitin, Ond, or triple paste to protect the skin. Consult your pediatrician. If the diaper rash doesn't improve within 2 to 3 days, consult your pediatrician. Persistent rashes could be caused by eczema, a bacterial or yeast infection, or other conditions that require medical treatment. 5. The importance of calming touch. Your touch on your newborn's skin does more than just provide comfort, it's crucial for their development. Giving your baby a massage not only conveys love and affection but also has numerous health benefits. Research shows that touch triggers hormones, boosts immunity, and helps fight disease. Massaged babies are also calmer, sleep better, and cry less, every parent's dream. There's no need for a special technique when massaging your baby. Simply lay your baby on a soft blanket in a warm, carpeted room. Use a little baby oil or a gentle lotion warmed in your hands, and massage your baby's chest and tummy with a gentle yet firm touch. Make eye contact and talk or sing softly to your baby during the massage. If your baby seems fussy, they might not be ready for a massage, or the touch might be too firm. The key is to enjoy this special time together,